I am here today with Dr. Shovan Rath, who treats patients without any discomfort. Therefore, let's interact with him and learn more about him and his innovations. What is your idea behind Painfree Orissa? Do you have any plans to extend rest of the India?
Yeah, Painfree Orissa is just a concept actually that was conceptualized in 2010. In fact, when I came to Bhubaneswar, there was no active interventional pain clinic in Odisha. So the first plan was to establish one clinic, and gradually we will extend it. We'll start it in Bhubaneswar, then we will gradually extend the process to all over Odisha. So initially, because the subject was new, my plan was to make awareness and create awareness among the people so that people will be knowing about the importance of pain management and what are the interventional pain procedures that we are doing that we should adapt. That is why the name I have given from the very beginning was Painfree Orissa, to make Odisha pain free. And the first clinic we started in Bhubaneswar. Gradually we will be increasing these clinics to different places in Odisha and in fact outside Odisha, so that these services can be available all over India.
So can you explain about interventional pain management and palliative care?
Yeah, interventional pain procedure, I meant to say, these are interventions that we do. Normally what happens, pain management is a subject that comes from anesthesia department. It's you can say super speciality after anesthesia. So just like neuroanesthesia, critical care, these are differences. It is just like another super speciality, that is pain clinic or pain management services. In that there are two things. That is, one is the palliative care, where we are providing palliative care services, means end of life care services to the terminally ill patients, like cancer patients, neurological patients are there who are bedridden and they cannot move about, and they are almost like bedridden and in the terminal stages of their life. So that is one part, that is palliative care. And another is interventional pain management. What we do is we basically fill up the gap between medicine and surgery. What people know is, one part is medicine. We need to suppose I am feeling from some kind of pain, so I'll take some kinds of medicine or I'll do a physiotherapy. If not, something is coming out, then I should go for a surgery. But there is a large gap between medicine and surgery, and we basically fill up this gap, and that is called interventional pain management. And by that means interventions we do at the spinal cord or at the nerve level. There are different nerves in the body, they carry out the sensation to the brain. So our basic role, in a layman language I can say, we just cut the circuit from the pain source to the brain, so that brain won't be feeling that kind of pain, and we can go with the normal treatment of the disease. So this is what is interventional pain management. There are various techniques are there. This is in a simple language I can say, we cut the circuit so that patient won't be feeling any kind of pain. That is interventional pain management.
Are there any side effects for this treatment, sir?
I'll be glad to say that there is no side effects in all of these procedures. The best part is these procedures are daycare procedures. So we do it on a daycare basis. Patient would be admitted in the hospital. There is no need of any kind of general anesthesia. So there is no risk of anesthesia also. We do it in a local anesthesia per se. Patient will be conscious, and there is almost nil complications or very negligible complications that goes away with the normal procedures or normal injections that we feel. That's it. So, and the beauty of this procedure is number of times we can repeat this. It is not that once the surgery is done and second time it cannot be done, but this is something it can be repeated many a times. And another best part is there are many people, like somebody who is suffering from a cardiac illness, somebody is having diabetes or hypertension. For that, suppose they are afraid of going for a surgery, or surgery cannot be done in those kind of patients.
The awareness about pain management is common in US and other developed countries. What is the reason behind Indian medical community is not aware about it, or it is due to political or any corruption?
No, there's nothing with the politics or corruption. This medical part is we can say is pretty new. Anything that comes to the society, people need some time to adapt that. Per se, I'll be giving an example of suppose laparoscopic cholecystectomy or doing a surgery with a laparoscopic method. People were conversant with the open surgeries. Now, when laparoscopy came into the market, it was not easy for the people to adapt that how somebody can do a surgery with a camera. So what they are doing, they didn't know. It took a long time for the people, maybe in India or outside also, to adapt that procedures. It is the same way. Pain management is there from the very beginning. Initially, it was a part of Department of Anesthesiology and Pain Management. So it was not a different department. So what we were doing, we were providing acute post-surgical anesthesia. जो pain होता है, मतलब the pain that is appearing after the surgery, acute pain, that we were managing. But there was nothing much about the chronic pain. It was only limited to cancer pain management. Now gradually, with the advent of different new techniques that usually happened outside India, almost like after 80s or 90s that came to India, and gradually new pain clinics started budding at different levels and different medical colleges, different private hospitals. Initially they started in different medical colleges only, and it took time. That was the reason people didn't have awareness, and the main part was doctors even were not aware who are the patients who should be sent to pain clinic. That is why it is taking time. And now the Indian Society for Study of Pain, which is the national body for pain, they are taking a lot of care for this, so that we will be making awareness at each level, because there are state bodies, at the district level there are different bodies. We are continuously doing CMEs, different educational programs in different schools and other CMEs, where we can educate the people.
Are the other states of India are not aware of this pain-free treatment, or it is limited in Odisha only?
It's actually a vast question, because as I said, there is less of a awareness among the people regarding pain management services. Many doctors also don't know about the services that we provide, and that is why we go to different media houses also, we do different CMEs and at different level to educate the people what is pain management services. It is not that it is limited to Odisha only. What I have done is, when I started in 2010, I have given a name it as Painfree Orissa, so that people will adapt to this, that we want to make Odisha pain free. Simultaneously, different states, different pain clinics are there at different medical colleges and private hospitals. It is not that it is limited to Odisha only. And our national body, that is the Indian Society for Study of Pain, they are also taking lot of steps to make this subject established in India, so that people will be knowing about it.
Is there anything wrong with the concept of pain-free treatment, or just people don't want to adopt it?
It's not that the people don't want to adopt this. It is less of a awareness. That is what I will say. More of people should know about pain clinic. That is why what we are trying is, now we are tying, very soon we'll be tying up with the government, or so we are trying this, we are in a phase, so that different pain clinics will be established at different states. We want to different districts in Odisha, so that it can be easily accessible to all the people, because it may not be easy for somebody who is staying in Sundargarh and Fulbani. He will come over here and have the pain management services. So in future, maybe within a year or so, we are planning to establish different setups at different districts, so that it will becomes easy for the people. And because from the very primitive day, people know about if you talk about pain, they will go to orthopedician, they will go to neurologist, they will go to neurosurgeon. It may be anybody, whoever is approachable or whom they can easily approach. People don't know about pain management. They are asking me, what is the pain management? Are you from orthopedics? Are you from neurology? So this is a new branch which is coming up, and all of us should try hard to let people know what we are doing, so that it becomes easy for the people to avail this kind of services.
What are the services offered in this treatment?
Yeah, that will come to the basic part of pain management. It starts from head to toe. Initially, if we divide, there are two divisions, that is acute pain and a chronic pain. Acute pain is something when you are having an injury, then you are treating it. It is just like a normal, and you have an accident or something, then you have some kind of painkillers and that goes away. Now, if some pain stays with you, even after the medical treatment, physiotherapy, everything, that stays for more than 3 to 6 weeks, that we tell as a chronic pain. And it can be either a cancerous pain or a non-cancerous pain. what we do is we try to block the nerves. Suppose per se we'll start with the cancer pain. Suppose somebody is having a gallbladder cancer, there is a celiac plexus of nerves which usually takes the signal from that place. We go to that place, put some amount of acid so that it will be burned out, so that patient won't be feeling any kind of pain. So from head to toe, anywhere the cancer is, we can block those areas so that patient won't be feeling any kind of pain. There are oral medications also. Nowadays there are patches are coming. You can just put the patches and they will be working similarly as the oral medications. And these kind of interventions where we put injections. This is, we can put alcohol, we can put phenol, which are acting like acids. Or else there is one machine that is called radio frequency machine, that is the domain of again pain management services. That through that we are hitting an area and we are burning that nerve particularly, so that patient won't be feeling any kind of pain. This is all about cancer. Now coming to non-cancer, you name anything from head to toe, migraine headache, atypical facial pain, or anything with the trigeminal neuralgia, anything with the cervical spondylitis, anything with the frozen shoulder, tennis elbow, per se wrist pain. Then coming to lower back, low back pain, or radiculitis or sciatica pain, what people usually say, osteoarthritis, knee pain, which is very common, then ankle pain and the heel pain. This I think covers everything. So anywhere where we can have pain relief without surgery is coming under this. So many diversities are there. Anything from head to toe, any kind of pain can be relieved at pain clinic without surgery.
Odisha is the main leading state in all the fields, including medicine. So what's your take over it?
Yeah, including all the fields, I'll also say that including pain management services, again, Odisha will be a leading state because we are providing all sorts of interventions. You can say anything at par with outside India services. Everything procedures are being done under ultrasound as well as under fluoroscope. These are guided procedures, as I said, and these are the only services which is available at this place. You can say we have this hospital, Health Village Hospital, where in the brand of Painfree Orissa we are providing this kind of services, and this is at par with any of the services available outside Odisha, outside India also. So in no way we are far behind, and people should know about it, that pain management services are now available in Odisha and they should avail this.
As we heard, you worked in some hospitals as an in charge and as a department of anesthesia. Why you opted in your own clinic? Why not in some hospital?
Yes, some hospital I have worked initial days when I came to Bhubaneswar. Actually, I was new to Bhubaneswar, so I joined over at some hospital. They have also helped me a lot in establishing pain clinic. In fact, that was the initial place where I started my pain clinic with radio frequency machine as well as the ozone machine. They have helped me a lot. But gradually I wanted to establish the services to the common man at different areas. So that is why I wanted to have my own project, so that it will becomes easy for me to spread it to different districts, different areas, and it should be with my ideology what I want. That is why I wanted my freedom to serve the people in my way. Which may not be possible. It is not about some hospital, it is about any other hospital. It may not be possible. That is why I choose to have my own hospital where I can serve the people the way I want.
Thank you for watching. For more updates, please follow us.